Good afternoon, everyone, and thank you for joining us. My name is Dr. Ronnie Bell. I'm a professor at the Wake Forest School of Medicine and the director of the Office of Cancer Health Equity at the Wake Forest Baptist Comprehensive Cancer Center. And I am going to be hosting today the second in our lecture series for the Southeastern American Indian Cancer Health Equity Partnership. And we're very honored today to have Dr. Rodney Herring from Roswell Park. But before I introduce him, I want to tell you a little bit about SciCEP. So this is a new initiative that is a partnership between our cancer center at Wake Forest, the UNC Lineberger Cancer Center, and the Duke Cancer Institute. We started this initiative just a few months ago, and our focus is on understanding and addressing the cancer-related health needs of our American Indian communities in our catchment area and beyond. And for those of you who don't know, North Carolina has 8 recognized tribes. The Eastern Band Cherokee Indians in the western part of the state, which is the only federally recognized tribe in our state. And then in the southeastern part of the state, we have the Lumbee, Cohesion, and Waccamaw-Siouan. And then the northeastern part of the state, we have the Meherrin and Halawa-Saponi. And then in the north central part of the state, we have the Occaneechi Band of Saponi Nation and the Saponi tribe. And we also have 4 urban Indian centers in our 4 largest cities in Fayetteville, Greensboro, Raleigh, and Charlotte. And so this SciCEP initiative is led by myself, Dr. Tomi Akinyeminju at the Duke Cancer Institute, and Dr. Stephanie Wheeler at UNC Lineberger. And we are very excited about what the future holds for this partnership. And we have put together a number of initiatives already in addition to the lecture series, which I mentioned. This is the second of those of the lectures in our series. The first was held, the kickoff lecture was on September 8th with myself and Dr. Mark Emerson, who is a faculty member in the Gilling School of Global Public Health at UNC. We also are in the planning stage for a lecture by Dr. Hannah Warax Forsyth, who is a cancer researcher, a member of the Lumbee tribe, so be on the lookout for that session. We also next week will be participating in a COVID vaccination clinic and distributing cancer information to members of the Lumbee tribe that will be held on November 30th. And we're planning to do other events like that in the coming months. So let me get to our speaker so I can give him plenty of time for his presentation. So Dr. Rodney Herring, he and I go back a few years now, but he is the director of the Roswell Park Center for Indigenous Cancer Research, research faculty at Roswell Park Comprehensive Cancer Center, Office of Community Outreach and Engagement, Department of Cancer Prevention and Control, and adjunct faculty at the Native American Research and Training Center at the University of Arizona. I won't read through all of this, but I will let you know that Dr. Herring is a wonderful leader in the field of Indigenous cancer research, has a national presence in this space, and I've just considered an honor to be a colleague of his and a friend, and it's been wonderful to see his career evolve and the work that he's doing up at Roswell Park. And so we're very fortunate to have him today, and so I'm very much looking forward to his presentation. I'll also mention that there are no disclosures associated with Dr. Herring's presentation today. Dr. Herring does have a financial relationship with Bristol Myers Squibb. This relationship has been mitigated and has not influenced the planning or implementation of this activity. So with that, I'll turn it over to Dr. Herring.
Well, Dr. Bell, I appreciate the introduction. I appreciate the invite between the partnership that the cancer centers have created in your region. And, this presentation will build on that. So, you'll hear about what a partnership is and a collaborative or a collaboration. In essence, what we would term as a collaborative. And so this presentation kind of speaks to that about building cancer care collaboratives for the 7th generation. My name is Rodney Haring. I'm Seneca from the Beaver Clan, Cattaraugus territory of the Seneca Nation of Indians, which is located about 30 miles south of Buffalo, New York, and situated on the border of New York and Canada. And I'm currently the director for the Center for Indigenous Cancer Research at Roswell Park. And Roswell Park is the oldest cancer center in the United States, which was founded in the mid-1800s, 1868, I believe. Next slide. To begin off, just a virtual land acknowledgement. Virtually, we acknowledge our respective indigenous landscapes and the ancestral lands in which we situate and traverse. To recognize the land is an expression of gratitude, appreciation, and a way of honoring the indigenous peoples of past, present, and future. Next slide. As Dr. Bell had noted previous, one financial relationship in the disclosure to Bristol Myers Squibb Foundation, my role as a co-PI in a grant. Next slide. And the objectives here. And so I'll just briefly go over these, but there will be a couple quiz/poll questions throughout the presentation, so you can participate and see how well I've done in sharing some of the educational objectives here. But basically, utilize and understand treaty conversation and what that means in the cancer care process, whether it be research, education, patient care, and what that means between Native Nations, cancer centers, and federal and state relationship building. Attendees will conceptualize how to build culturally congruent practices, quality improvement roundtables, program evaluation, CBPR practices, and ethics of what that means towards the benefit for Native Nations. And also basically a dreamstorming, which is a term that I learned from a colleague, Dr. Eric Brodt, about what that means to co-create sustainable cancer care collectives towards healthier generations. Next slide. And so I'll start just a brief description of the Center for Indigenous Cancer Research. Although I've been at Roswell Park for just over 10 years now, roughly 10 years, both as faculty and prior to that in other capacities, the Center for Indigenous Cancer Research is fairly new, and it was established right at the beginning of the pandemic. In fact, we had our kind of grand opening plan, and then everything was shut down. But we continued on during the pandemic in creative ways and to share kind of the blueprint and the story and the efforts that we put forward during the pandemic is a lot of what I will be sharing today and what that means not only for our center here at Roswell Park, but also what that means for other cancer centers, collaboratives, and institutions wishing to kind of understand how to work with Native Nations. So our mission, MOU, outreach, education, research, patient care, these are all things that we have really paid attention to during the development of the Center for Indigenous Cancer Research, but also the approaches that are important to our Indigenous communities and on the stories and the treaties and the wampum agreements and how that interplays with a lot of the work that we do. Working together not so much in a competitive fashion, which oftentimes universities or institutions are, I wouldn't say put against each other, but we often compete for things. But in a true Indigenous kind of perspective, it's better to work like the collaborative that's forming in North Carolina between the cancer centers is really a good model to follow. And I'll share some of the collaborations and collaboratives that we've put together over time too, and what that means. And when you do that, you put the health of all future generations in kind of this bundled arrows approach, which creates opportunities to braid treaty conversations at the tribal, federal, state, county program levels between tribes, urban health centers, Indian health services for the health and wellness of all peoples. And if you take a brief look at that image on the slide, you'll see two. One is in front and one is behind, but each has their own representation. And so it's important to understand and learn about the history of the tribes in your region. In your case, across North Carolina. In our case, across New York, Ontario, and Quebec, because our Native nations in this region, before the United States and Canada, lived on both sides of the river. And so in the image you see in the front, you'll see 5 arrows that are bundled together. And the story and kind of lesson in our history of the Haudenosaunee, or the Iroquois, the Iroquois people, really talks about the being connective in a collaborative fashion. And there was a story in our history that talks about a chief who said to a group of men and said, there's ways to approach different things in our lives. And one is about working together in strength. So he invited one of the warriors to come up and gave him a single arrow. And he asked the warrior to break the arrow. And so the warrior picked it up, and of course he was able to break the arrow fairly easy. And the chief said, well, here's 5 arrows. I'm going to wrap them together and I'm going to bundle them. Now I want you to break these again as one. And so the chief, or the warrior, picked up the arrows, bundled 5 of them, and was not able to break it. And the chief said, this is a representation of how we should work together as our Native nations. And at that time, of the Haudenosaunee, or the Iroquois Confederacy, as the French called us, we ourselves call our Native nations the Haudenosaunee, or the people of the Longhouse. But of our original 5 nations, when we were working together, and instead of arguing or competing or going to war against each other, but when we worked together and formed a collaborative or a collective sense of governance, and that when a word of peace came to us and what that meant in our history, and how to work together in a peaceful and mindset that created strength and moving forward with a good mind and the way that we approach situations as a collective or a collaborative, was really important in our structure of history, and what that meant as our people coming together as one mind and one strength. And I see that with a lot of our the way we work, not only in our lives and between our nations, but also in the work that we do. Behind that image of the 5 arrows bundled, you'll see the Hiawatha belt, and that's the representation of the original 5 nations of the Haudenosaunee. And in the middle was the Onondaga Nation. It's kind of the central fire where all the nations would come together across our confederacy and discuss important issues of governance and a collective mindsets of how to improve our communities and be at peace and to address things like education and healthcare, even since the beginning of time. And on the western side of that, you'll see those squares. Each one of those squares represent a Native nation as part of the Haudenosaunee. On the western side is the Seneca Nation, and on the eastern side, the Mohawk Nation. And we have about 9,000 members of the Seneca Nation, or Onondaga, that live in this region, our ancestral lands here across New York. And on the eastern side, the Mohawk Nation, also a fairly significant number of people, likely around 12,000 on the New York side or so, roughly, and then perhaps another 12 to 15,000 on the Canadian side. And so our people are great in numbers, and when we put all our minds together and our tribes together, our confederacy is fairly large. Now, later in the American history, you'll read about the Tuscarora Nation, who came from North Carolina area up to New York area and joined the Haudenosaunee later on in history, and that they are still here and are part of our Haudenosaunee as the 6th nation that was added on and have a seat at the table. Whether I know that there are also Haudenosaunee and Tuscarora that live in North Carolina, so it's, I'm very thankful to have the opportunity to also speak and share about the Confederacy and our efforts across the kind of the Northeast corridor. And just a few days ago, I had the opportunity to also meet with the Seneca of Oklahoma, who were part of the Indian Removal Act from New York, Ohio, and then Ohio to Oklahoma. So very honored to also meet with them. Next slide. And so knowing your landscape is really important. And as Dr. Bell had shared, and really looking at some of the how the tribes situate in your respective landscape or your state. In this slide, we had another slide that kind of overlaid the tribes in the U.S. and then cancer centers, and we were in the process of updating that because it's really important. But as more cancer centers emerge in the U.S., whether it be a cancer center or a comprehensive cancer center or a basic laboratory, it's really good to know not only where they situate in kind of U.S. states, but also what is the relationship in proximity to native nations geographically. And if you look at this map here, you'll see a number of cancer centers kind of sprinkled around the coastlines. Kind of interesting. Kind of the northeast, there's quite a few, and then not so much in the lower half, and then again on the western area of the United States, predominantly around California, you'll see a number of cancer centers as well. However, there's a large gap in the Great Plains area for NCI or NCI-related cancer centers. So take a kind of a mental snapshot of that picture. And you can see New York, where I'm situated. Roswell Park is a comprehensive cancer center, and that would be at the top of the map, about 4 states to the left from the right side. Next slide. And on this slide, you'll see how Indian Health Services breaks down in the United States. And in New York, you'll see a lot of kind of red squares, and those are considered CHSDA counties. And that's where Indian Health Service kind of works throughout and has data collection mechanisms. You also see part of that in the North Carolina area and South Carolina, I believe, in that region. But that whole area on the eastern side is noted as Indian Health Service Nashville area. And when you look at Indian Health Service Nashville area, that's kind of how patient care and patient care in relationship to cancer center care is one relationship to understand. So that's all part of kind of getting your knowledge, knowing your landscape is part of, if you think about all these maps together, where the cancer centers are, how Indian Health Services has the ability to provide services in your region. And I know that there are a number of state and federally recognized tribes in North Carolina, in particular the Eastern Band of Cherokees, which is on the western side of North Carolina, likely has a relationship with Indian Health Services. And a number of state tribes have unique mechanisms with the state as well for Indian health care, as well as urban Indian centers. Next slide. And so to dig even deeper to understanding your kind of indigenous landscape and tribes and what that means is really important to understand in relationship to cancer health disparities and other disparities and the general health of the people. And so we wrote a paper, and I share this as a mechanism or a research methodology to think about when you work with tribes, and it's something we published on a few years back. And I think Dr. Bell was actually at some of those planning sessions when we still have a collaborative relationship with Mayo Clinic and the Native Research Network. But some of these, to dive in further into understanding your community, you really have to know what the cancer health disparities are in the communities you work with, and even more so to understand the relationships with the Native nations and what their disparities are, so to better attend to. And research is part of that process. And research, when you translate that, it should should be forward thinking on the translation, what that means for patient care and community wellness. And so here you'll see that what we did was we took the counties that overlapped federally recognized Native nations in New York that were ancestrally related, and that would be the Haudenosaunee. So each one of those purple images on the New York State is a county that touched a reservation in which was part of the Iroquois Confederacy of the Haudenosaunee. And what we did was because many tribes and Native nations may have smaller numbers and smaller sample sizes. And also, you really know if there is a small number type project, you don't want to hone in on kind of one tribe with a small number because, it may produce something that's disclosed and identifiable. So a good approach is to take aggregate numbers from in this case, aggregated tribes at the macro level that are ancestrally related. And we did that looking at the tribes in New York, but we took 10 years of that data and looked at mortality patterns. And so when you aggregate all the tribes and you look at 10 years of mortality, you're not specifically identifying one tribe, but more of a kind of a macro level picture. And we looked at the disparities for a number of different things, including cancer, healthcare, and we compared against non-Hispanic white American Indians in the Northeast and then American Indians nationally. Next slide. And what we discovered, are of course important in the context of research and epidemiology, but also more importantly, it's something that we've been able to share back to the tribes across our region, and really kind of share what some of those health disparities are. And there's just a few noted here, but there's the citation if you're interested in learning more about that, not only about the project, but I think the methodologies that we use were also really important to understand, and kind of knowing your landscape and working together as a collective across cancer centers to find the best. One, it's a good collaborative type project to work on, but secondly, it really provides data to bring back to the Native nations and tribes that you work with, or Native urban centers, to create programs that attend to some of those issues that are concerns that may be there. Next slide. Another important way to know your landscape is a project that we initiated right before the pandemic, perhaps maybe about a year and a half before. And what we did were macro level roundtables with area Native nations. And again, I share this some of this work because I think it's important in the kind of that collaborative process, not only between cancer centers, but also within the tribes and the communities, to really understand what the relationship is. But it's also a way to get to know your tribal partners and urban Indian partner in the city area partnerships. So we went out and we connected macro level roundtables with area Native nations with adjacent rural provider safety network providers in different areas that were around reservations, because healthcare isn't really it isn't just a reservation or an area where Natives live, because a lot of times, all times, Native community members may initially get screened or be part of services on a reservation or in an area where Native Americans live. It could be in an urban or rural context. But more than likely, if there's a treatment need, you're leaving the reservation or area that you're used to, going to a city, receiving care, and then coming back to your Native community. And then you're working with adjacent safety net providers above and beyond some of the patient care that's available in the community. So it's really important to not only understand the tribes and relationships in the region and the kind of the cancer center care, but also the safety net providers that do work with tribes. And so we went around to our nations across New York and to Ontario and Quebec areas of the ancestrally related tribes in our region. We did one-on-one interviews. We created a film, but I won't show it here, but I did provide the link. We brought a Roswell Park media team with us, and then worked with Indigenous filmmakers and Indigenous producers to create a short documentary of our travels. And it's open source, free for anyone to use, but it kind of shows our process of what we did and how we went about it. And that's really important, you know, from a media context too, is to really integrate that. In the research realm, it's called CVPR, or community-based participatory research. But it goes beyond that, especially in media developments or communications, is you know, to bridge in and work with tribal partners, not only in the research context, but all the other forms from cancer center to community, for example, marketing, media, really bridging out and beyond on the research context to make it the relationship between the tribes and the native urban centers part of that process as your cancer care collective collaborations continue. And then we also, the importance of collaborating with our Indigenous Intertribal Community Advisory Board. And I'll speak a little more about that in a couple slides up. So that's another part of knowing our landscape. So one is geographically, but also, you know, the relationship of building projects for like this one here with roundtables between Indian Health Services and cancer centers, providers in the community and cancer centers that work with Indigenous populations. Next slide. So here's a poll question. And I think somebody may be helping with this one. So
yeah, I'll launch the question and give you 15 seconds to respond, and then we'll share results.
Excellent. Doing my job. I'm going to 100%. Thank you. Next slide. And so now I'm going to move into a little more about how our Center for Indigenous Cancer Research came about. And this is kind of the process that we went through. This is the process that we continue to use and to create and build our center. And I share it because the more cancer centers can create their initiatives around this and strategic plan to include Native nations in the programming, whether it be research, patient care, education, the greater the health of the people, all people, Native people, including Native people and communities. And so this approach is something that we've dreamstormed over time, and it really came into existence through the leadership at Roswell Park and through champions at Roswell Park, really having an open mind and being part of that collaborative process from the beginning. One is, I'll talk just a little bit about the research side of things, but how the Cancer Center to tribal government, Indigenous CVPR outreach and education. What's unique about research in Indian country is that, you know, as PIs or co-Is in Indigenous research, there's another level of relationship building that a lot of PIs and other types of research don't have to do. And so building relationship with tribes, an important feature is really understanding leadership, governance at the tribal level, having to present to tribal governments the process of sustained relationships with tribal governments, the relationships of dissemination of materials with tribal governments, the process of community-based research with tribal governments and ethics around that, and what that also means in the context of outreach and education. So, you know, there's courses that are coming out around what that means and how to go about that, but it's really, you know, sometimes it's a challenge because, you know, every tribe, there are over 550 federally recognized tribes, and then quite a few state recognized tribes across the United States, and then over 500 bands in Canada. And each one is a little different. The governance is a little different. The process of research is a little different. So if you're doing a multi-site study, and you have to present and get approval from 3 different tribes, for example, you have to understand those tribal cycles of governance, leadership and resolution process, along with data user agreements, MOUs, and that's quite a bit of work for a research project. So one unique feature that we've had at Roswell Park recently is the time release for community-based type research, and that's been helpful for individuals like myself who are, you know, in the trenches working with tribes and really building up the relationship to do research, service, education. The same is true for in the clinical context, to work with IHS, to the Cancer Center, community-based IHS center, community-based IHS centers and cancer centers, and what does that relationship look like in a clinical context for MDs and others that work in the patient side of things. And the encouragement of professional research development by conferences, conference presentations, networking, joining government committees, both you know, tribal government, but also in the state and areas in which you situate. Being part of grant reviews is an important feature. On you know, it's a talent to be part of, especially NIH type grant reviews in which tribal governance is part of that process, and also journal reviewer opportunities to have an Indigenous voice in some of the, I know it's our duty to kind of be part of that as well. And with all those 3 of those things are just kind of things that we've incorporated into our center to, you know, one, be part of our institutional side of things, but also externally in the community and professional development. Next slide. Outreach is important, and as Dr. Bell shared, even through this the series of lectures is really important, and it's changed over time, right? So there's like a more virtual and kind of hybrid approaches coming out as we learn more about the pandemic and how we've been working through it as people worldwide. So one important feature that we initiated in our center was the inclusion of an Indigenous outreach health educator on campus, but also into the communities, rural, suburban, and urban and tribal. And that's another duty that, you know, before our center was developed, is that, you know, I was the one that was going out to, and my research assistant, Whitney Ann Henry from Tuscarora Nation here in New York, were doing a lot of outreach events in the communities because we were always being asked. And that is actually a full-time job to go out, set up at health fairs, integrate into the health systems. So, you know, part of our planning of our center was to include more outreach people. And so we hired William Mabey, who's Allegheny Seneca, to join our team, and he works across the Haudenosaunee and beyond virtually now. And then, as I mentioned too, another good part of outreach to consider is, you know, working with cancer center media marketing teams, and then building contracts for agreements with tribal media and social media to promote collaboratives, projects, and health messaging. That's a really good program that we've incorporated, is really building that relationship between media and tribal media. Film producers, a lot of tribal governments and Native urban centers have their own marketing team. So how do you interact with those two and bring them together? And that's really important to do, especially in creating indigenized messaging that are relevant for your communities. A third thing is we've also created a quarterly newsletter. You're more than welcome to sign up at our website, and you'll get a kind of what our newsletter looks like. We've created podcasts for the general public, and those are all open, and we do interviews in the community. We do interviews from our staff. We do interviews from people at Roswell Park working in Indian country. And we've also created our own center's Indigenous social media. And so all those things, you know, kind of tied into the pandemic and the needs to really outreach virtually. But I think that's, you know, it has worked for us. And we collect information about how many people log on, as many people, I think institutions are really creating kind of a digital approach of what that means and what that looks like. But that's a really important piece of outreach that we've incorporated. And again, you can visit our website too and look at that. The Indigenous project branding on campus and for our communities, the CR images is part of a lot of our work. And then building Indigenous spaces on campus. So as you start to build collaboratives and collectives working together, what does your Indigenous space look like on campus? What does it look like for your patients? What does it look like for when tribal leaders come to visit campus? And what does it look like for staff? And you'll see this in a number of, not only in universities, where you know, there's a wing that's honoring the Indigenous peoples of that ancestral landscape. And, you know, what also is important in outreach is really creating these collaboratives. So I'm very thankful to be virtually presenting to North Carolina and the collaboratives that are forming there. And we've worked with the Mayo Clinic over time and created the Native Circle, which was founded by Dr. Judith Cower many, many years ago. And through collaboration, we've acquired that in an honoring context to bring to Roswell Park. And we digitized it. We add materials in there, and it's for everyone. It isn't just for our regions here in our area, but it's for all Native nations. And it's basically a repository of Indigenous cancer-related materials for the community. And many of them are made by the community for the community too. So it's a really interesting kind of repository for literature, outreach materials, and information for tribes. And then pre-pandemic, we also worked with Mayo Clinic, which I believe was the first kind of joint cancer center to cancer center cancer conference, which was held in Niagara Falls. It was called the Spirit of Eagles. And so those are the type of things I think that, you know, we can learn together, we can share together as collaboratives, and we can grow that and continue that. Those things need to grow and continue. We need to work together between all the cancer centers and understand our respective landscapes for the health of the people. Next slide. Education is also part of that. And so looking back, you know, I think research is important in the title of our center, but it goes beyond that, right? And so education is definitely part of that. You know, building out the process for inclusion for Indigenous internships, for example, with tribes in your region, and building out internships within your cancer center. What is your strategic plan for that? What does it look like? What has been done in the past? Build out collaborative internships with other internal departments. So it may not only be the department you're in, community outreach engagement or cancer prevention, but what does it look like working within your cancer institute and creating opportunities for basic scientists from our Indigenous communities? What does it look like in the marketing department? What does it look like in internships and communications or media? So those are all important to think about. And we've begun that process here at Roswell Park. I've had quite a few interns over the summers that have been an integral part of many of our research projects and have succeeded onto the next step of graduate school or medical school. Building MOUs, memorandums of understanding with educational programs, with tribal education departments, very important. And that goes beyond, you know, I guess the patient and research side of things, but what is your relationship with tribal education, and how does that include the cancer research or MD type patient care relationships for education? The inclusion of a postdoc. Are there postdoc postdoc opportunities for Indigenous postdocs in your cancer centers and how they work with tribes, local tribes, and also creating travel scholarships with the tribe for opportunities for Indigenous youth at all levels. It says here undergraduate, graduate students, but even at the high school level, really important. Next slide. The clinical advisors too. Do you have Native or Indigenous clinical advisors on staff that work with the communities? I think that's really important. We have that here at Roswell Park. We have Dr. Michelle Heiser and Dr. David Matson, who is Native Hawaiian, and Dr. Heiser, who's Dene or Navajo. But they provide not only clinical supervision to our center, but also if there are any community questions, they're on call to work with the community as well. So that's an important feature that we've put forward and understood, that, it isn't just research, or, there's a lot of patient and medical questions too that come about in our community context. And what does that process look like for your cancer center? Next slide. Indigenous advisory councils are important. We established that right away as well. And we have one for our center, kind of a micro or meso level, department level. But also, what does that look like for the community, the cancer center as a whole? And is there an Indigenous voice on the larger cancer centers advisory board? That's really important too, that we, especially because many of the cancer centers are situating in ancestral lands of some tribe. And what's that voice in that area? How does that interact with the cancer center? And I share these all as just a blueprint of something that we've initiated, and it's worked within our context that maybe can translate to other cancer centers and to gain the perspectives and voices of the people. Next slide. We also incorporated, especially during the pandemic, some cohesion and team building type things to keep us sane during the pandemic, because the pandemic was, of course, challenging for the world, right? But we by doing weekly staff meetings, either virtual or hybrid, was very important to creating projects, and then meeting with our community advisory board quarterly, who helped us keep grounded to the community. And we've done that virtually, and now are starting to engage more in a hybrid type version of that. Quarterly team building events are important to incorporate, and this isn't just for our work, but I think it's important to any organization or department. And for us, it's tying back to some of our ancestral ways of being, which is important to our Indigenous staff in our communities. But examples like horseback riding, fishing, lacrosse, beading. So that really ties us, not only our work that we're doing, but ties us ourselves back to our communities. And much like you're doing here, invite nationally recognized speakers to present at greater campus events on Indigenous research. So if there are other teams on campus that have interest for their grand rounds, the encouragement of including a Native speaker quarterly is something that we've begun to initiate here as well. Been very open to that. But then mentoring for yourself and being a mentor to others. Next slide. So poll question 2.
15 seconds.
Very good. Next slide. So I'll share just a little bit about the Tworow Wampum. The Haudenosaunee and the Dutch, and later the French, English, and Canada agreed on these three principles of friendship, peace, and forever. And in a lot of our work, we tie back and we braid back into our conversations and thought process of what that means of working in our research or ways of life or just being. And the Tworow is a concept that was, that you'll see that he's holding a wampum belt that is a traditional kind of like contract, a way of sharing information from nation to nation. And within those, you'll see the two lines that are two purple lines in the, across the white beads, and the representation of that the native people will travel in one canoe and the non-native people to travel in another vessel, and that the lines never cross or intersect, and that we respect each other's ways of life, that we respect each other's way of governance, that we respect each other's way of healthcare and politics, and that they never interfere, but we need to understand both, and that we work together in a parallel fashion, never really tipping our toes into the other canoe, but working together in a good way to coexist. And our health systems are like that too. And so we think about that when we work in our communities and with our tribal governments, that they're, you know, for us, fashioned in that way, and in the Tworow kind of philosophy. Next slide. Foreign affairs. So tribal governments as governments, like Roswell Park also has a government relations team member that assists us in some of the work that we do with tribal communities and serves as a liaison. Your cancer center may have a government relations office, and it's really, it was really important for us to establish that relationship early. And the government relations office here has a really open mind to learning and be part of that process, and it's been really good. And also, if you haven't, some of these items of collaborative nature also is kind of at a global scale in the UN Declaration of Indigenous Human Rights. So that's also an inclusion in a lot of the work that we do, whether it be grant, service, or patient care. Next slide. Creating sponsors and donors. We've also created a not-for-profit arm as part of the Cancer Center to work within our programming to help sustain it, where communities, tribes, people can donate to our efforts. And I think that's really important too, that there's an opportunity to grow that. So another idea to shape and share that we've been successful at in growing the efforts that we have. Next slide. Building international associates. And again, because of the pandemic, we haven't really gotten too far with this, although we have done work in, for example, the Sami of Norway, the Maori of New Zealand, and a lot of First Nations, Métis and Inuit populations in Canada. But it's really important to, you know, it supports collaborations across borders, provides opportunities for educational exchange, and especially true for like the Haudenosaunee that have ancestrally related tribes that span across international rivers and borders. Next slide. And poll number 3, give you a few seconds for that. All right, thank you. On the next slide. And to kind of round out the conversation, within our context of the Haudenosaunee and many other Native nations across the world that I've interacted with in our team as well, is really the 7th generation philosophy. And that the things that we do now, the things that we learn now, the research that we're creating now, it's not just for the now, it's not just for the tomorrow, it's not just for next year, it's not for your children of next generation, but it's for 7 generations forward, that all the knowledge that we're gathering in the projects that we're creating, these collaboratives that we're putting together, is really for the health and well-being of 7 generations forward. And through multidisciplinary sciences that include both Indigenous knowledges, or IK, Western and Western knowledges and disciplines, really needed to work together to create this collaborative for 7 generations forward. And looking beyond the U.S. to global knowledges are really important too. That's why the international context of understanding is really important. And also understanding the internet, and if you look at an international context too, it's really nation to nation, what other tribes are doing in your region, what other tribes are doing in your state, and we're part of that process to you and you to us, of us learning from you of what you're doing as a collaborative, which is really a great start, and what we've accomplished and some of the successes and gaps, and going beyond that, how we can work together as part of these growing cancer care collaboratives across the U.S. and beyond, and keeping an open mind to that. And then building sustainable plans for the benefit of our next 7 generations. Next slide. So in summary, I really tried to touch on the comparing and contrasting of cancer center strategic plans, and I'll include Indigenous initiatives. And I think we're all at a good start. The conversation is growing among cancer centers, and the collaboratives that you have in North Carolina are awesome. They're just growing. I can see a lot of growth there, and I'm thankful for the opportunity to share our growth here this past year and how that came to formation over the last 10 years, and really creating strategic and sustainable plans with this good mind, or a good way of thinking, and being respectful and understanding our Native nations, what that means for the 7 generations forward, and the inclusion of the UN Declaration of the Rights of Indigenous People. And to evaluate our efforts. That's also important. How well are we doing? How well are we translating research into care for our communities? How well are we educating our youth to be the next generation of Indigenous scientists? And I believe that's it. One more slide. One more poll. Excellent, thank you. And then the last slide is just the contact information. If you have any additional questions beyond our Q&A chat here, you can, I believe you can put your, if you have any questions, you can put it in the Q&A, and somebody will help moderate that. Thank you.
Thank you, Dr. Herring. That was a wonderful presentation, very enlightening. Thank you for the work that you're doing, both in your region and as well as nationally. So we have a few minutes for questions. I don't know if we have any in the chat yet. So I'll ask one. So what have been some challenges in this developing your program and developing the relationships with the community?
Well, of course, the big one has been the pandemic, right? And the challenge in the forefront was really learning about the virtual platforms and how that integrated into the communities, especially in rural communities where there were the digital divide, so to say, was there. Both the use and understanding of some of the equipment and software and platforms, but also the availability of reliable internet to be part of that. And so, but 1 year later, there's grandmas and others that are grandpas that are on real internet savvy now and tech savvy. So that's part of the resiliency in our communities to see that. I think just the time and effort to really create a process that wasn't just initiated just over a year ago, but it was really kind of the conversation leading up to that, and building relationships with tribes, and understanding that, at many cancer centers, it isn't just patient care, right? It isn't just a hospital, but there are research arms, and it's not just basic science, but there are community-based practitioners, and then of course the education piece, what's available for our students to come in, and really I think bringing or braiding all those conversations into it's really important, and then to understand some of the historical nuances. So it's important that we were trained to be like Indigenous scientists, But at the same time, we have to know our history in order to be effective. So what are the treaties? What are the relationships? An example, like I know, like even Eastern Band Cherokee's treaties, I think are tied to the two other federally recognized Cherokee nations in Oklahoma. So what is that relationship and what does that mean to North Carolina Cherokee Nation?
Great, thank you. Any questions for Dr. Herring? Well, seeing none, thank you again. I will share this wonderful story about Dr. Herring. He and I served on the Native Research Network board several years ago, and the Native Research Network had their annual conference on the Eastern Band Reservation, and that was around the time with HB2 in North Carolina, and the state of New York had banned travel to the state of New York. And Dr. Herring made the very compelling argument that he was not traveling to the state of New York. He was traveling to the sovereign nation of the Eastern Band Cherokee Indians. So he was able to come. So that was great. So thank you again. And Dr. Herring has his email address there. So if you'd like to follow up with him, you feel free to do that, and be on the lookout for our next SciSep lecture. And thank you very much.
Great, thank you. Now we appreciate the ask and opportunity.
Thank you so much, Dr. Herring and Dr. Bell. We hope you enjoyed today's SciSep lecture. We want to thank the people of North Carolina through their support of the University Cancer Research Fund and the UNC Lineberger Comprehensive Cancer Center. We want to thank our team, Tim Poe, Director, Mary King, Operations Coordinator, Veneranda Obori, AV Support Engineer, John Powell, Continuing Education Specialist, Oliver Marth, Technical Support Technician, Jason Taylor, Technology Support Technician, and Andrew Dotson, Technology Support Technician. Next.